Coronavirus disease (COVID-19). What everyone should know and the way to protect yourself and your children. You will not find one person who is not talking about coronavirus disease 2019, also called COVID-19, and there's so much information everywhere about the virus and how to protect yourself from it. You need to know the facts which help to prepare on how to protect yourself and your loved ones. Sadly, most of the information out there is incorrect. Incorrect information during a health crisis leaves people unprotected and susceptible to the disease and spread fear and stigmatization. What is a novel coronavirus? A novel coronavirus, or COV, is a new strain of coronavirus. The disease caused by the novel coronavirus, which was first identified in Wuhan, China, has been named coronavirus disease 2019 or COVID-19. CO, which stands for corona, VI for virus and D for the disease. Earlier, this disease was mentioned as 2019 novel coronavirus or 2019 nCoV. The COVID-19 virus is a new virus linked to the same family of viruses as severe acute respiratory syndrome (SARS) and a few types of common cold. Coronavirus has been declared as a pandemic by the World Health Organization. What does that mean? Pandemic is when an infectious disease spreads around the world significantly from person to person quickly. When the virus is brand new, with no vaccine or treatment to prevent and where our body is not immune to the virus. How does the coronavirus spread? The virus is spread through direct contact with respiratory droplets of an infected person, generated through coughing and sneezing, and touching surfaces contaminated with the virus. The COVID-19 virus may last on surfaces for several hours, but simple disinfectants can kill it. Symptoms of coronavirus. Symptoms include fever, cough, and shortness of breath. In more severe cases, the infection can cause pneumonia or breathing difficulties. More rarely, the disease is often fatal, but that's mainly among older people and those with pre-existing conditions. These symptoms are almost like the flu, influenza, or the common cold, which are a lot more common than COVID-19. This is why getting a test done is helpful to verify if someone has COVID-19. The essential prevention measures are the same: frequent hand washing, and respiratory hygiene. Cover your cough or sneeze with a flexed elbow or tissue, then dispose of the tissue into a closed bin. Also, there's a vaccine for the flu, so make sure to keep yourself and your child up to date with vaccinations. Who are at higher risk? Coronavirus can affect anyone, but people with pre-existing health problems and older people would be at greater risk of developing severe symptoms. People who are older, those with weak or compromised immune systems, and people who have underlying chronic conditions including asthma, diabetes or heart disease followed by hypertension and high blood pressure and some cancers are more at risk of severe effects. How to avoid the risk of infection, precautions you can take. Wash your hands frequently and thoroughly using soap and water or an alcohol-based hand rub for a minimum of 20 to 30 seconds. Wash your hands often, especially before eating, after blowing your nose, coughing or sneezing and using the bathroom. If soap and water are not readily available, use an alcohol-based hand sanitizer with a minimum of 60% alcohol. Make sure to wash hands with soap and water, if hands are visibly dirty. Cover your mouth and nose with flexed elbow or tissue when coughing and sneezing. Dispose of used tissue immediately. Avoid close contact with those who have cold or flu-like symptoms. Do not touch your eyes, nose or mouth if your hands are not clean. Keep a distance of 6 feet between yourself and others to minimize the spread of the disease. Seek medical help early if you or your child has a fever, cough or difficulty breathing. Social distancing. Most countries have encouraged social distancing by banning large gatherings, encouraging telecommuting and closing schools. People should avoid social gatherings of more than 10 people, and avoid eating or drinking at bars, restaurants, and food courts. Avoid traveling with family and children if possible. Prepare your own food and avoid going to a restaurant or even getting takeaways. Does COVID-19 affect children? This is a new virus and there is no known enough information yet about how it affects children or pregnant women. But we all know it is possible for people of any age to be infected with the virus, but to date, there have been relatively few cases of COVID-19 reported among children. The virus is tragic in rare cases, but mainly among older people and people with pre-existing medical conditions. Do masks prevent coronavirus? The use of a medical mask is suggested if there are respiratory symptoms, coughing or sneezing, to protect others. If you don't have any symptoms, then there is no need to wear a mask. Wearing of the mask alone is not enough to prevent infections and must be combined with frequent hand washing, covering sneezes and coughs, and avoiding close contact with anyone with cold or flu-like symptoms, coughing, sneezing or fever. If masks are worn, they need to be used and disposed of properly to ensure their effectiveness and to avoid any increased risk of transmitting the virus. Can pregnant women pass on the virus? No, there's no enough evidence to support whether the virus is transmitted from a mother to her baby during pregnancy or what impact it might have on the baby. Pregnant women should take proper precautions to protect themselves from exposure to the virus, and seek early medical care, if experiencing symptoms, such as fever, cough or difficulty breathing. Are there medicines to treat the virus? There is no particular medicine to prevent or treat the new coronavirus. The simplest thing you can do is practice basic hygiene. Sharing the facts about COVID-19 and understanding the actual risk to yourself and people you care about can make the outbreak less stressful. You can help make people feel less stressed and allow you to connect with them by sharing the correct information. People around the world are taking necessary precautions to protect themselves and their families from coronavirus. Sound preparation, self-awareness, not socializing and taking care of your near and dear ones is what is needed at this time.